Before you go to bed tonight, make sure to adjust your clock as we spring forward into daylight saving time. But that change could have adverse health effects on some people. 13 on Your Side health reporter Elena Holland talked to a doctor about the increased risk of heart attacks and death following the time change.
Spring forward is always a little bit problematic.
Dr. Thomas Boyden is the medical director of preventative cardiology at Corewell Health. He says this spring's time change brings challenges for many.
We've often seen that there's an increased cardiovascular risk, typically with heart attack risk, sudden cardiac death, and stroke.
But how can a single hour less sleep really impact our health so much? Dr. Boyden says it has to do with our circadian rhythm, which is our natural rest and wake cycle.
The fact that we're getting up earlier when our cortisol levels are coming up to naturally wake us through that circadian rhythm is also kind of probably what pushes people more into that heart attack risk because they're waking at a higher cortisol time.
Those most at risk are people with underlying health issues already, like diabetes, high blood pressure, sleep apnea, and high cholesterol.
The big risk seems to be on the day after the change, so the Monday and the Tuesday. And if you look at the data here in Michigan, we see about a 10 to 24% increased risk of heart attack during those 2 days.
You can prepare for the change early by being kind to your body in the days leading up to the change.
To start adjusting those schedules just a little bit, take care of yourself on that day, so try to stay stress-free if you can.